It is now 11:30, so we are going to go ahead and get started. This is our last Lunch and Learn of 2025, which is just crazy. The year has flown by, but welcome to our November Lunch and Learn. Before we get started, a couple of housekeeping items. If you are interested in using live captions, you're going to navigate up to the ribbon at the top. You're going to select More. You're going to go to Language and Speech, and then you're going to select Show Live Captions. If you would like to have live captions in all of your team meetings, you're going to go back up to that ribbon. You're going to select More. You're going to go to Settings. Then you're going to go to Accessibility, and then always show live captions in my meeting. So if that's something you're interested in utilizing, that information is there for you. I'm going to put that in the chat here in just a moment so you can have that info. All previous recorded Lunch and Learns can be found on the TEIS Community Resource website. So if you're interested in watching any past Lunch and Learns, you can find those there. Another reminder for today's presentation, any questions that you may have, please place those in the chat. Kara will complete the presentation and then she'll address the questions at the end. So any questions can go in the chat and we'll cover those at the end. I'm very excited about today's Lunch and Learn. I think this is really important information. We all know about TEIS, but I think that it's great that we are also aware of other programs and services provided by DDA. So we have Kara Kamari, the Assistant Commissioner of Communications and External Affairs for DDA with us today, and she's going to give us an overview of DDA programs and services. So Kara, go ahead and take it away.
You know what? I started my, you'd think I had done this for a while, but I started talking and realized I hadn't been on mute. I'm in my office today, so and we just moved buildings. So I have 3 screens going, and apparently it wasn't set up right. So I had to move my camera to where the presentation is. And then I've got another one here, and then I've got another one here. So, so apparently it's a little bit presentation challenged, but I think we're good now. My name's Kara Kumari. I am very excited to see there's about 140 people on this presentation and that all of you all are so interested in the amazing stuff that we do at DDA. Thank you first and foremost for what you do for TEIS and for our littlest Tennesseans. Getting them started on the right path helps not only them thrive, but also they're able to experience more independence as they move through some of our other programs as well. And so I can't thank you all enough for what you do. All right, let me figure out what screen I'm on and we're going to go. Okay, so a little bit about the Department of Disability and Aging. As many of you all know, the bulk of what we were was DIDD, and what TEIS has been housed under since 2020 was the Department of Intellectual and Developmental Disabilities. Well, in April of 2024, Governor Lee signed the Disability and Aging Act into law. And what this did was merge the Department of Intellectual and Developmental Disabilities with the Tennessee Commission on Aging and Disability, effectively creating the Department of Disability and Aging, and that was effective last July on July 1, 2024. So why did he do it? First of all, adults 65 and older are the fastest growing demographic in the state of Tennessee, especially in East Tennessee, where more people are choosing to retire for the natural beauty, for the great business and economic climate. No state income tax is clearly a draw as well. And there are a lot of great reasons that we all choose to live in Tennessee. And that is also attracting more and more folks over 65 and older. TCAD was Tennessee's federally designated state unit on aging, but it was only one of only 2 in the country that was not housed in a cabinet level agency. So DIDD and TCAD provided supports to their populations. They're 2 very separate populations, but we do a lot of things that are to support people in very similar ways. And there are some common issues that we share. Housing, caregiver support and availability, access to transportation, and also whether you're starting your life, we're maximizing independence, or as we're aging, we also want to maximize independence and dignity. So those shared priorities really made it a natural connection between DIDD and TCAD to become DDA. So now we've got DDA. Who does DDA serve? First, we serve adults aged 60 or older. We also serve children and adults with intellectual and developmental disabilities of all ages, and also adults with physical disabilities as well. So that is our service population. It is more than 1.5 million people, which is just astounding because that's a large, large, large number of people in the state of Tennessee. So we're going to go through a bunch of these services, but this is just a quick snapshot of a lot of the different services that we provide. Obviously, they start with TEIS. We also serve kids in the Katie Beckett Part B program. Transition age youth and adults who want to become more independent can be served in our MAPS program. We have home and community-based services, and then we have things like the long-term care ombudsman, seating and positioning, nutrition services, benefits counseling, family support program, and more. And over the course of the next 50 minutes, I'm going to be taking you through a lot of these different things. So, and feel free if you have questions to drop them in chat and I'll answer them afterwards. So I'm going to say this baby is very, very cute, and TEIS you all know about. So I'm not going to spend any time on this one. As you all know, we provide therapy and services to children in Tennessee from birth until the start of the school year following their child's 5th birthday. You are all aware that these services are provided at no cost to families and that anyone can refer a child to TEIS. We do accept referrals for children under the age of 3. So now we're going to go to some of the other programs we offer. One of the programs that works very closely with TEIS is our Katie Beckett program. And I'm guessing that many of you all are familiar with this Katie Beckett program. This is a program that serves children younger than age 18 and is for children who have disabilities or complex medical needs. These children are not eligible for Medicaid because their parents simply make too much money. They have too much in income or assets. However, if not for that income limit, they would be Medicaid eligible because of their disability. So we offer services in the Katie Beckett program in 2 parts. The first part is Part A. This is the part that is really for the children with most significant disabilities and complex medical needs. These children receive full Medicaid benefits. So these are services such as home health care services, in-home nursing, medical equipment and supplies, OT, PT, speech therapy, audiological services, and non-emergency transportation. And they also receive up to $15,000 a year in what are called wraparound services. And these are services for things that help sustain family caregiving and allow kids to stay at home rather than receive care in an institution or a hospital, which we never want to have children in those settings. We do want them to stay at home. In that Part A program, 70% of the costs in that program are usually due to skilled nursing. Many of these children have very significant needs, and they do need that in-home nursing, and that is one of the most utilized service in the program, and is the one that's also the most costly and accounts for about 70% of the budget in the Part A program. Katie Beckett Part B, and I should say that Katie Beckett Part A has about just under 300 people in that program. Katie Beckett Part B is the much larger part of the program. This has about 4,700 people in the program, and we do have a waiting list in this program as well. This is a program for children with complex medical needs and disabilities who do not qualify for care in a medical institution. So they don't have that very high bar of significant disabilities and complex medical needs that they would meet what's called institutional level of care, or they're waiting for a slot in Part A. So the children in Part B must meet what's called at-risk level of care. And they are not enrolled in Medicaid, so they're not getting full Medicaid services. What they are getting is help from DDA to pay for up to $10,000 a year of care for their child in a flexible benefit sort of way. And we'll go through what some of those are in the next slide. So here are the different services, and families can choose to spend that $10,000 per child per year budget on any or all of these services. The first is health insurance premium assistance, and it's basically what it sounds like. It helps families pay for the cost of the child's private insurance. The second service is by far the most popular service. In fact, almost every single person in Katie Beckett has this on their person-centered support plan. It's the HRA, the healthcare reimbursement account. This is similar to what our employee-sponsored HSAs, where families can use a card to pay upfront for qualified expenses, or they can pay for expenses and get reimbursed off after the fact. These are IRS eligible expenses, but this can be used in a very flexible manner to help really target what that child and family needs to sustain that family caregiving. Then we also have non-traditional therapy reimbursement, consumer-directed respite and supportive home care, where people can hire someone to provide respite or supportive home care, and then agency-based services that are very similar to those wraparound services offered in Part A. So now that we've talked about TEIS and we've talked about the Katie Beckett program, which is for under the age of 18, we'll talk about MAPS. And MAPS is a program that's relatively new. We've had it here for about 2 years. And it's called Medicaid Alternative Pathways to Independence. This is a program that really is trying to help young adults and adults maximize their independence by giving them the tools and technology they need to help them work, live, and engage in their communities, and really tailored towards the things that they want to achieve in their lives. It really focuses on the establishment of natural community networks. How do we engage folks in their communities and help them make friends and find jobs, and then provide those independent living skills as well? Part of what so many transition age youth learn in schools is about how to develop job skills and soft skills. But then we take them out of the school system, and do they know how to do their laundry? Do they know how to cook? Do they know how to call an Uber? Things that will help them get to that job and help them continue to live their lives independently. Really, we're looking to provide a pathway to participation, contribution, and the rewards of independent achievement. This has been a tremendously successful program. We have about 700 enrolled in it. It's a time-limited program. People are usually in the program for 3 years. And what we have seen is that people are able to accomplish things they never thought were possible. We had someone at our tech summit last week, just a young woman, talk about how MAPS helped her not only get her driving license, but she was able to take a certified nursing assistant course, and she passed, and she is and has been licensed as a CNA. So already people are able to achieve their dreams using MAPS because of the tools and the technology and training that they have been provided through this program. So we'll talk a little bit about our long-term services and supports programs. We have ECF Choices, which stands for Employment and Community First Choices. This is the long-term services and supports program for people with intellectual and developmental disabilities. It's also called a Medicaid waiver. Employment is a significant focus of this program, and services are tailored to help people explore, obtain, and maintain employment. This program does also offer in some groups residential services. I will say that the services provided and the expenditure caps, they vary by groups. There's group 4, 5, 6, 7, and 8. And each group has a different service population, different services provided, and then a different cap for services. Now, this program is administered by TennCare and the state's 3 MCOs, and then DDA does intake into the program for people who don't have Medicaid, and reportable events, quality management, and a lot of different other areas where DDA's expertise is helping people to support people in this program. We also have the Family Support Program, and this is a long-standing program. It's a state-funded program that many of you might know about. And then I know we have at least one EIRA who is not only a EIRA, but also a family support provider. So some of you all might also, actually, I think there's more than one. So some of you all might be very familiar with the Family Support Program. This is a program that's designed to assist individuals with severe disabilities and their families remain together in their homes and communities. So this is a program that provides small targeted grants to families to help sustain family caregiving. The primary purpose of the program is to support families who have school-aged or younger children with severe disabilities, adults with severe disabilities who choose to live with their families, and then adults with severe disabilities that aren't in like one of those Medicaid waiver programs that are funded by state or federal funds. So the average grant in this program is usually somewhere around $1,300. There's a lot of local control in this program as well, with local councils, and then it can be very flexible to meet the needs of the families that are enrolled in this program. Also, in all three regions, we operate seating and positioning clinics. This is one of the things where so many people don't know that we do this, but are like, wow, once they learn about it. So our seating and positioning clinics manufacture custom molded wheelchair seating and positioning devices. And just as a note, they can do it for very young children and have types of devices that can grow with the child as well. This is really important because imagine if you are sitting in an uncomfortable wheelchair that's not molded for you all day, every day, and you might be nonverbal and you can't tell us that this chair is not working for you. This can lead to skin breakdown. This can lead to bowel obstructions. This can lead to aspiration issues. Optimal positioning really does a lot to not only improve comfort, but it really also ensures optimal health. We do have 3 clinics in each region and 2 mobile clinics for those who live far away. Many of you all may be aware, and some of you might not be aware, we are actually in the process of building 3 new regional offices, and we are going to also have updated new seating and positioning clinics in all of those regional offices. With West, well, they're moving into the offices in West, but we expect to have those seating and positioning clinics up and going at the beginning of the new year, probably January, February, in our regional, in that West regional office, with Middle and East coming closer to late summer, fall of 2026. But all of these services are still available right now, and they can take insurance. So you do not have to be enrolled in the DDA waivers or in the ECF choices to potentially be able to get services in this program. So that's how we help support people who are medically complex. We also have a lot of adults in our program and children that are have some real complex behavioral issues. And our TN Start program has been designed to help address some of those. Children 6 or up can take advantage of 10 Start. And this is a statewide resource for individuals with intellectual and developmental disabilities who have complex behavioral or mental needs. As I mentioned, it's available to people 6 years of age or older, currently receiving or eligible for Medicaid waiver services. Some of the things that are important to know is that this can offer 24/7 on-site or remote crisis response and also consultation, because part of what makes this program so great is working with a person's supporters to identify triggers and learn how to prevent a crisis, but then they can also help be boots on the ground when a crisis helps. The 10 Start program has been extremely successful. We have been able to divert people out of emergency rooms, out of jails, out of mental health institutions, because of the fact that we're able to have people who are trained to on a person's specific needs, but also on people with intellectual and developmental disabilities respond when a crisis happens, and also provide the training up front to keep crises from happening in the first place. So benefits counseling. This is a relatively new program that we're offering. It's also very cool. This is a program that helps people see a clear pathway to employment. One of the things we know is we have been promoting employment for people with disabilities as an employment first state for a very long time. But one of the biggest barriers to people seeking employment is fear that somehow by working, it will reduce or eliminate the benefits, because there are income requirements in the Medicaid program that help them get that job. So benefits counseling is really important so that people can understand the pathway to employment and how that may impact their benefits, as such as Social Security, SSDI, Medicaid, and Medicare. We provide individual support. We do one-on-one support to help individuals see the relationship between working and benefits. Spoiler alert, you will always make more money having a job. And DDA's benefits coordinators assist with exploring work incentives to make achieving employment goals possible. Also, we provide education and training to other disability service professionals and stakeholders so that they know how working can increase benefits. So if they don't come to us, if they come to another stakeholder, they're not discouraged at that level, and that they can seek more information about how working can really benefit them. Finally, going to mention our Tennessee Strong Families program, going back to the kids for just a second before I get into our aging programs. So this is also a relatively new program for us. As a part of Governor Lee's Tennessee Strong Families Initiative, DDA is now serving children in DCS custody with IDD who have very complex medical needs. We do this right now in two different ways. First, we have short-term residential placements for children who are currently placed in the children's hospitals. And what we've done is we, when we moved out of our institutions, we built intermediate care, 4-person home intermediate care facilities for people with that were moving out of our institutions. Some of them have moved on or passed, and some of these homes were vacant. Now we have repurposed these homes so that they can provide medical care to these complex children and be a temporary placement for them until a more suitable foster arrangement is found. Prior to these homes being stood up, many of these kids were staying months, days, months, weeks in hospitals, even though they didn't need to be there. They just had nowhere else to go. So now we're able to give them homes. They're able to go to school. They're able to have the medical treatment they need, while also having the life, being able to be a kid. Because being a kid in a hospital, when you are ready to be out of the hospital, is not what we want to see. Also, for children with IDD who are in foster care, we offer flexible support similar to the Katie Beckett Part B program, that HRA benefit that we talked about, the one that everyone's using. We are also providing that a similar benefit to children with IDD who are in foster care so that they can also have that flexible support and be able to access some of those medically necessary items that TennCare might not cover. So those are all of our programs for children and adults with IDD. Now I want to talk a little bit about the programs we offer for our aging individuals, those adults 60 or older. First, a little bit about TCAD. If you all had never really had a lot of experience with them, TCAD itself was actually created by the Tennessee General Assembly in 1963 as the Commission on Aging. As I mentioned, it is our federally designated state unit on aging. And in 2001, it was renamed the Commission on Aging and Disability. So they were given the authority in 2001 to serve adults with physical disabilities under 60. July 24, TCAD became the Division of Aging under DDA. We still have a Commission on Aging and Disability that meets quarterly, but the majority of the work that is being done and administered by TCAD is also housed under TCAD. The Commission, as well as all of the employees, are now housed under that Division of Aging. So here's how the Aging Network works. We get a very, very large amount of funding from federal allocations that get sent to the governor, and then the governor also gives us state funds. Those funds come to our aging division, so TCAD, our aging division, and those funds are then distributed to 9 agencies on aging and disability, also known as the triple ADs. That's what we call them for short. That's where the services kind of flow from. The triple ADs, they send that money to service providers, community providers. You guys are all very very familiar with how those funds flow from us to you all, and then they go to our consumers, and they provide the services to our consumers. So very similar as far as using community providers to help serve people in the community, similar to how a lot of our other state programs operate just through the AAADs. Here is a map of our AAADs and their service maps. It's not, I don't think it's exact with the POE and POEs for TEIS, but you can see that it somewhat mirrors that same type of district area. And we have 9 of them. And you can see how they're broken up. Like I said, I don't think it's exact with our TEIS POEs, but it's fairly similar. So we have 10 programs that are funded by the Older Americans Act. That is that federal act that really dictates how we provide services. We're going to talk about a lot about some of these. We do have information and assistance, our senior centers, state long-term care ombudsman, nutrition services, disease prevention and health, national family caregiver support, home and community-based services, elder rights protection, and transportation. And then we're going to dig into some of these a little bit more. But we do try to operate a no wrong door approach here with our information and assistance lines. People can call, they get screened. We help them identify what services they might be eligible for, and then try to connect them with those resources. So we'll first start with our long-term care advocacy, our ombudsman. The Office of State Long-Term Care Ombudsman includes 9 district ombudsman programs. So these folks act as advocates for residents in nursing facilities, assisted care living facilities, and homes for the aged. Anyone who has had to have a loved one in one of those facilities. Sometimes it can be a big peace of mind to have somebody there to help and support the advocacy of that person. Ombudsmen are getting more and more calls every year. They've seen a huge increase in their workload. And they are many times that first advocate that can come in and help families address issues that they're seeing with their loved one and in long-term care facilities. They also do residents' rights education. They have partnerships with other entities. As I mentioned, they're getting more and more calls for help. Top complaints: abuse, neglect, exploitation, things we absolutely do not want to see, evictions, and care concerns. And then there's also a systems advocacy component as well. And here is a picture of a group of our long-term care ombudsmen. So the biggest program we offer for folks who are older adults is our aging nutrition program. This makes up about 70% of our budget. So through the Older Americans Act, federal law authorizes grants for community planning and social services, and nutrition services fall under Title III of the OAA. There are 2 different ways we do this. One is congregate nutrition and one is home delivered meals. I'm going to talk more specifically about those, but the goals of the nutrition program are to reduce hunger, food insecurity, and malnutrition, enhance socialization, promote health and well-being by assisting in gaining access to nutrition, and delay the onset of adverse health conditions resulting from poor nutritional health or sedentary behavior. So we'll first talk about congregate nutrition. This is meals in social places. This is eating with other people. There are over 200 congregate locations across Tennessee. You can find these congregate meal locations in senior centers and other areas, and they're available Monday through Friday, except on holidays. So these meals are available to anyone 60 plus, as well as their spouses at no cost. Eligibility for these include adults 60 plus and spouses of adults 60 plus, individuals with disabilities who are not 60 but live in a housing facility occupied mostly by folks who are 60, volunteers who work during meal hours, and individuals with disabilities who reside in the home with and accompany adults age 60 plus who are eligible. Like I mentioned, a lot of these congregate meal sites happen at senior centers. Some of these folks serve 200, 300 people a day with these congregate meals. They not only are great places to get healthy, hot meals for older adults, but they are also a great way for people to make friends, get to see friends. And we've done a couple of videos at senior centers where people said they came for the free food and they never left because of the fact that they made so many friends and realized that there were so many activities to do at the senior center. So really providing good nutrition and also that socialization and companionship as well. And then we also have home delivered nutrition. Sometimes this is referred to as Meals on Wheels because Meals on Wheels is one of the biggest contractors of home delivered meals. These meals are designed to assist those who are sick or homebound to get a hot, nutritionally balanced meal at home. So not only does that meal volunteer provide that meal, they get a friendly visit, and they also could do a safety check. Is everything okay with that person? Have there been some changes? We have so many folks who are unable to leave their homes, and that really creates a lot of risks with isolation. Some they could be targeted by scammers. Nobody whether we know they have good food in their house, and really, if something is going on in their conditions, they might not be able to tell anyone, and that volunteer who comes can really help them with those things. Eligibility is adults 60 plus and spouses of adults 60 plus, physically or mentally unable to obtain food, prepare meals, or lack support to have meals provided for them, frail or homebound. It says this will be changing soon. A non-elderly person with a disability who resides in a non-institutional household with a person eligible to receive a home delivered meal. So those are all of the eligibility for this. We serve thousands of meals. We deliver thousands of meals a day. And for a lot of folks, this is the only hot meal that they get and the only access to a hot meal that they have. So how to sign up? You can find a congregate meal site by using the map on our website. We have a map, shows you where those congregate meal sites are. You can complete a participant registration form and nutrition screening initiative checklist. We screen them annually using this. There are, as I mentioned, 200 locations available in all 95 counties. Talked about how a lot of senior centers are locations, churches, community centers, a lot of those places are where you'll find those congregate meals. Also, home delivered meals, completion and evaluation of the independent living assessment and NSI checklist. Nutrition risk scores are used to establish nutrition risk and provide outreach and education. And then we are screening folks annually to ensure eligibility. So here are some of the numbers. You'll see some of the different types of pictures of the different types of meals that are offered in those congregate sites. For federal funding in FY 2023, we served 22,422 clients with 2.2 million meals. State funding, we served 5,266 clients with 693,000 meals. And then we got some additional funding and were able to serve an additional 9,300 clients with 384,000 meals. So total meals served, 3.3 million meals in the state of Tennessee. Wow. Takes a lot of work and a lot of volunteers to make that happen on a day-to-day basis. Okay, so we also know that chances are in the last 10 years, you or an immediate family member has had a challenge, and caregiving is, people think of caregivers as only paid folks, but caregivers can be all of us. We may be caregiving for our mother or our father or someone else in our home, our children. And for a lot of folks, it can cause a lot of us our parents may be aging at the same time while we're raising children, and are also aging ourselves, and that can all cause a lot of emotional, physical strain, and it can be difficult. So we do offer through our National Family Caregiver Support Program counseling and support groups, training, respite, personal care, homemaker services, and adult daycare. Now, it does depend on the service area, what might be available, but being a caregiver is more and more folks are becoming caregivers across the country, and Tennessee is no exception. So we currently have 5 state-funded program programs, and one of them is the Options for Community Living program. We call this the Options program as well. It provides, this is a state-funded program. It can provide homemaker services, personal care services, and also home-delivered meals. Really helps people who are older and aging remain in their homes rather than needing something that we've talked about a lot when we're talking about people with IDD, people, older adults, remain in their homes without having to go to an alternative placement by just providing that support, that sometimes minimal support that they need to be able to stay there. We also have a public guardianship program. This is a last resort for folks. This is a program that involves a fee unless deemed low income or receiving supplemental security assistance. This program should be utilized as a last resort for individuals. Ideally, if someone is unable to care for their basic needs, we would want a trusted family member to step in and help and assist. But sometimes that person doesn't exist. And so this is where this program comes into play. And types of guardianship services include person only, person and property, and then durable power of attorney. And then we have the Lifespan Respite Grant, which is a collaboration with the Tennessee Respite Coalition, recently renamed the Tennessee Caregiver Coalition. And the goal of this grant is to promote current respite services to caregivers and the public. We know that respite is one of the most pressing needs that not only do older adults have, but also parents of children with disabilities and parents of adults with disabilities. And we are really respite can be the key to helping to sustain family caregiving. And so we're going to talk a little bit more about it when we talk about some of the grant opportunities we've offered in the past. But we want to make sure that we're doing everything we can to make respite available to all of the folks that we support and their caregivers. Okay, we also have the Tennessee State Health Insurance Assistance Program, otherwise known as TN-SHIP. This is a program that was created in '92 and is currently funded by was funded by the ACL. Obviously, some things have changed in the federal government, but it is still being funded. This offers free, unbiased Medicare benefit counseling and assistance, and assists with low-income subsidy programs with Social Security and TennCare. What this does is it provides non-commissioned, unbiased education about primarily Medicare and Medicaid for folks, for older adults. Helps people understand what might be out there, what plans might make the most sense based on what their what their prescriptions are, and all of those different types of things that what medical conditions they might have. So this helps about 2,600 people that were provided with individual enrollment access and saves almost $5 million a year for beneficiaries by helping them understand really what's out there. Average cost saving of almost $2,000 per person. There can be so much out there that's overwhelming for folks when they are aging into Medicare with all the different plans and different insurance types and all of that. And what we want to make sure is that people are receiving good advice from someone who has no financial stake in the game. And so that is something that we're able to do through our Tennessee SHIP program, and run by volunteers, oftentimes through the AAADs. You can find these folks, but really, really a great program that can help save older adults who are often on fixed incomes with money that they don't need to be spending. And then we'll talk a little bit about our Dementia Capable TN program. We were awarded an Alzheimer's Dementia Programs Initiative grant to provide different services. One of the things I want to make mention of is that we have been ramping up is our dementia navigators. These are people that can help families when they receive that diagnosis for a loved one really figure out what do they need to. It can be overwhelming. There's a lot to think about, but what are those things that really they need to be thinking about? How to safeguard assets, how to help that person remain in their home. Those those different types of things that you don't think about, and then all of a sudden a person is receives that diagnosis, and then you have to think, what's next? That's what we are working with our dementia capable TN and our navigators and all of the stuff we do. We also do a lot of training about this to get the word out. We've got folks in our aging division that are going out to senior centers and different communities to help train people about what's out there and what are the signs to look for, so that we can make sure that we're getting the word out and helping as many people as we can. I want to make mention of this. So many of the services that are offered in our older adults area are not services where we pay somebody to run them. They are done by volunteers. It is volunteers who are driving those meals to folks out in the community. It is volunteers that are being trained on how to provide SHIP counseling. We need volunteers. That is how our programs run. You can see that in 2023, we had 11,989 volunteers that provided 532,000 volunteer hours and served 207,000 adults. We can't do the work we do in the aging space without those volunteers. So if you are ever interested in volunteering, there's a place on our website. We do have to conduct background checks because obviously we want to make sure trusted individuals are volunteering. But we can't do, we are the volunteer state, and our services in the aging space run on that spirit of volunteerism. So just wanted to make mention of that. If you are ever looking for volunteer opportunities, we've got them for you. So last, I'll just do a little bit to talk about how to apply for services. So for IDD services, each program has a different application referral process. I know we might like to make it complicated. You can find all of those applications linked on the DDA website. But also I want to make sure that you all know that the DDA regional offices can assist people in completing those applications. You can call those numbers, those intake numbers down at the down below, and somebody will help you navigate which program you need to be applying for and help assist you with applying for those services. For service for older adults, intake and services are provided through the 9 area agencies on aging and disability. So I showed that map. It had numbers on it before for all of them. That is the front door for our aging and adults with physical disability services. Okay, finally, community grants. So one of the things we found is we provide all of these amazing services, but there are also needs in the community that can help provide inclusion opportunities and greater access to the community for people with disabilities and for older adults. So DDA a couple of years ago really got serious about providing grants to communities and businesses to really help them spur inclusion and access. So here are some of the current and former grant opportunities we've offered. Grants for senior centers. A lot of senior centers, they keep their program fees low if they have any, or non-existent, and they have capital expenses that come up. They want to add more programming. They need money to do it. So we offered about $5 million in grant funding for senior centers this year, so that they could, it could be something like, we need a bigger parking lot because we have 200 people coming to our congregate meals, to, hey, we've always wanted to offer pottery, but we need to pay for a kiln and somebody who can help teach that to folks. So it can be something from programming, it can be a capital expense, just trying to make sure that our senior centers are welcoming places for folks and help engage our communities to prevent that isolation. Our Tennessee Believes grant was one that came about in 2021 for inclusive higher education establishments, really trying to expand access to post-secondary opportunities all across the state for students with intellectual and developmental disabilities. We had inclusive higher education institutes around the state, but oftentimes they only operated on program fees and a little bit of tuition costs, and for some they needed the basic capital to stand up those programs. And now we've been able to provide this funding to create new ones at community colleges, Chattanooga State, Dyersburg State Community College. UT Martin was just recently awarded one of these Tennessee Believes grants to create a program there. So to really expand those opportunities across the state. We also have in the past offered grants for churches and nonprofits to establish respite programs. As we talked about, respite can be a game changer for families and help really provide that relief for families. So we were able to offer about $750,000 worth of grants to churches and nonprofits to help them stand up respite programs to help them support their community members. We have offered inclusive playground and facilities grants to communities and nonprofits and municipalities. Play is a universal language. And, so many playgrounds are not able to be accessed by children with disabilities, whether it's mulch on the ground or just not having a way to get a person up onto a playground structure or not a swing. And so we were able to provide this funding to create inclusive playgrounds where everyone could come together and play. And we had that grant about 2 years ago, and it created several new playgrounds across the state. And then we currently have available our adult size changing table grants. These are up to $10,000 and includes installation and minor construction costs and the cost of the table. There are some requirements. The table has to be powered and height adjustable, has to be in a single occupancy restroom, and it has to be open to the public. You can see a video of one of the tables that was installed there. We've given grants to Dollywood. They have a table. The Nashville Zoo, I believe, has a table. So areas with community sites where now Nissan Stadium has a table, and I believe they're building one in the new gigantic stadium they're building as well. But these organizations saw the need to want to include people with disabilities and not having a safe place for them to change a barrier to enjoying what they have to offer. So those grants are available up to $10,000, and would just encourage you all to, if you know someone that might be looking to install an adult size changing table, to take advantage of that grant. Okay, I am done. So happy to answer any questions. I'm scrolling really quickly and I see there's one. Can you clarify at what age does the family support program end? 18 or 22 years old? Family support program, there is no age limit. It can be an adult that it can help sustain the family caregiving for an adult with IDD who is living at home. So it can be for children, it can be for adults who are living at home. The key thing is that it's for those people who are living at home. They might not be getting a service like a Medicaid waiver service or something else that provides more support, but it can be for adults who with significant disabilities who are remaining at home. Would seating and positioning services become available for our seniors now under our aging division? Yes. Like I said, it does. We have worked with insurance companies to offer. So that if folks have insurance, we can do and we can work with their insurance company to get their positioning equipment covered through insurance. But yes, it is available to anyone who needs seating and positioning services, not just folks with intellectual and developmental disabilities. Okay.
Thank you so much for your time today, Kara. This has been so informative. I think it's very important that TEIS folks know what can be offered under DDA, especially being in homes and working with families. It's great to have this information. So we greatly appreciate your time. I'll hang out a couple more minutes to see if any more questions come through. We'll give you a couple of minutes back today. We finished up a few minutes early. I have placed the form stack link in the chat. Please complete the form platform stack link to provide feedback for today's presentation and get your confirmation of attendance. Our next Lunch and Learn, so this is our last Lunch and Learn of 2025. Our next Lunch and Learn will take place on February 18th, 2026. That will be same time, 11:30 to 12:30 Central Standard Time. More information about that will be coming out in TriStarts and Staff Update, as well as the 2026 Lunch and Learn calendar. You'll be able to find that there. It does look like we have some questions coming through. I see, can we have a copy of the PowerPoint? We are not putting the PowerPoints on the community resource website anymore, but the presentation itself will be available. Kara, I'll let you answer that as far as if you want to provide that out to people, if you want people to reach out to you, you just let them know how you'd like to proceed there.
Sure. If you guys email julia.ballard@tn.gov, I'll drop her email address in and would like a copy of this presentation, I will make sure to give it to her so she can send it to you. And then I see my biggest challenge is knowing what all applies to our TEIS kiddos to inform parents about, besides the Katie Beckett, to private pay kiddos. You know, for TEIS, family support is definitely something that several TEIS family that you can get family support and TEIS. You can get Katie Beckett and TEIS. And then also, you know, seating and positioning clinic. There are several TEIS kiddos that have those really complex needs where the seating and positioning clinic has been able to assist them with that. So those are just some of the things off the top of my head I can think about that we would offer. But also where you're seeing grandparents and folks, you know, we know that more grandparents are taking care of their kids. So where you're seeing some of that, those areas, you know, it might be worth telling them about some of our older adult programs as well, especially some of the ones that help sustain family caregiving, like respite, etc. Kara, can you have family support and Katie Beckett? No. So you cannot have family support in Katie Beckett. You can have family support in MAPS, but you cannot have family support in Katie Beckett because that based on the flexible funding of $10,000 a year, and then the grant program of $1,300, or the grant program for family support, we don't mix those. Those folks do not get family support because we did and do in some areas have pretty long waiting lists for family support funds, and we also have waiting lists for Katie Beckett. So we want to make sure that we're serving everyone, as many people as we can, and so sometimes that means not double serving people with, you know, one person getting both when there are waiting lists in both programs, making sure that we're doing everything we can to maximize what people can be available for. Oh, and I do want to let you all know one thing. Speaking of Katie Beckett family support, the Katie Beckett program and the family support program work together. So if a person is on the waiting list and they're receiving family support, once they're enrolled in the Katie Beckett program, we internally work to make sure that we're, you know, that we can disenroll someone from family support, shall we say, and make sure they get Katie Beckett. Or if the person ages out of the Katie Beckett program, but a slot isn't available for them in ECF, and they're not interested in MAPS for some reason, that we can make sure that they know that the family support program is available for them afterwards to potentially provide that support in the interim. I just had a child I served qualify for Katie Beckett, but she was told there were 800 children ahead of her. Is that typical? So yes, we currently have about that number on the waiting list. I think it's a little less than that, might be 760, but it is a waiting list. And this is Katie Beckett Part B is a first come first serve program, meaning that folks are moved into the program off the waiting list based on when they were added to the waiting list. So somebody who applies tomorrow won't get services before someone who applied 6 months ago. We have in our budget request to the governor did ask for an additional, I want to say 2,000 slots for the Katie Beckett program. We did ask for a significant amount of new slots for the Katie Beckett program because of the huge growth we've seen and the waiting list we've seen. So obviously it's up to the governor to decide amongst all the budget priorities that every agency has submitted, what will ultimately go in his budget. But it is a request we have proposed making, and we'll find out when he announces his budget at the State of the State whether or not that was something that we could potentially see in July. Do they request the social security number of the child for the Katie Beckett program? Yes, I believe they do. Undocumented, quick, we get this a lot. Children that are not documented are not eligible for any of the Medicaid programs. So they're not eligible for the Katie Beckett program, and they would ask for a social security number. Any other questions? Even if his parents have the SSN, I would say that on that, I would say this. The application process will screen for eligibility. And if that person is not eligible, I believe as a part, the social security number is a part of the application. But that would be up to TennCare does that. We do the medical eligibility part on Katie Beckett. TennCare does the financial eligibility on Katie Beckett. So that would be a part of that review. But if the family is not eligible like based on citizenship for TennCare, they would not be eligible for this program, because even though you can't be eligible for TennCare based on money for this program, you still have to apply for the Katie Beckett program through the TennCare Connect website and apply for Medicaid in order to apply, get rejected from Medicaid in order to apply for the Katie Beckett program. It's confusing, I know, but it is to make sure that a person might not be eligible for Medicaid otherwise. Are there any review processes to see if the stipend should be reduced for some families with KB? Some families who have KB funding are literally looking for ways to spend their money, even publicly on Facebook. No true needs, just don't want to lose money. The way the program is structured right now, it is primarily a $10,000 allocation for folks. And not everyone uses all $10,000 for it. We would ask people to be a good steward of their taxpayer money. But yes, I have seen this instance come up from time to time. We're always looking at utilization data as well in both of those programs to really understand the true needs and costs. But not him. As far as the social security number, I do believe that a child has to have a social security number to be able to be in the Katie Beckett program. But I would say this, that would be something that would be a part of the application process. And could be looked into as the person is applying for it. I would TennCare Connect. I wouldn't say it's information about SSN requirements, but it would be a part of that application requirement. But I do believe that the child has to have a social security number in order to be eligible for the program. Has that always been the case? I want to get some clarification on the social, but the program has never. I need to get some clarification on the social security number thing. But if the question is whether or not the person, because usually this comes up in the same vein as immigration status, it has always been the case that Medicaid programs do not, any of the Medicaid funded programs, people who are undocumented do not qualify for our programs. So that's That's usually how this question has come up in the past. But I will get some clarification and pass that along to Emily, or you can email me and I'll look into this for you if it's just about the social security number. But if it is an immigration status question, then I would say that child is not eligible.
All right, everyone, we have about
Awesome.
1 minute left. If anyone has any remaining questions for Kara, you can drop those in the chat. I can get those to her, or you can email me and I can get those questions to her. She did provide that email address. If you all are interested in obtaining the PowerPoint, that email address is in the chat. Again, thank you so much for your time, Kara. This has been so informative. We will see you all next year for our Lunch and Learn in February. If anyone has any questions regarding Lunch and Learns, always feel free to reach out to me at emily.greer@tn.gov. Yeah, everyone have happy holidays and thank you for attending today.